I'm Dr. Michael DiTolla.
And I'm Megan Strong.
In our case of the week, the world's first three-story crown and bridge impression.
And an MMA fighter has a knee-jerk reaction to a tooth extraction.
And the residents of Dallas decide they want us to be able to place lots of crowns 3 decades from now. That and more on today's Chairside Live. Hey now, hello and welcome to episode 104 of Chairside Live. Megan, what's shaking?
Well, growing a baby,
Yep.
And I'm about 9 months pregnant, so this actually is my last Chairside Live before I go on maternity leave.
Really?
Yes, tomorrow is my last day before leave, and this is it.
What is your due date now?
July 16th.
July 16th, okay. So we're not quite knocking on the door.
No, but at this point, I'm a little bit past 36 weeks, and they want you to hit 37, and then once you hit 37, it's pretty much any time can be go time.
All right, so we won't see you again until we actually film Childbirth Live.
Yeah, no, that's not happening, so...
To your knowledge, it's not.
Right, yeah, not at all.
To your knowledge. I just want you to know, though, that there is an OBGYN at your hospital who looks an awful lot like me. So don't be scared when somebody who looks like me comes in and starts to
never ends
shout dental terms that sound a little like what he's supposed to be saying, but
No.
not quite exactly the same. Well, we've got a good last Megan's episode for you today. We've got an interesting case of the week. It kind of looks like an H&H impression, but it goes beyond one layer beyond that. It's the tri-layer impression. I caught my eye as I was walking through the crown and bridge department because you usually don't see 3 different colors on a crown and bridge impression. In fact, let's go ahead and take a look at that now. As a laboratory, we're not huge fans of the H&H impression technique. We've mentioned it before in the case of the week. And, some dentists will tell us that they're doing it and ask for extra coats of dye spacer. Today, that means extra coats of digital dye spacer, where we'll add some extra spacer. But a lot of dentists will do the technique and not say that, and we end up with crowns that are too tight and they won't go down all the way. And we also have occlusal issues. Like what we'll see on this case. My biggest issue with the technique is that it's a technique that's really centered around not wanting to pack cord. And so, we come up with this technique. It's a 2-step technique to drive the wash material subgingival so that we don't have to pack cord. And but it carries some liabilities with it. And as a result, we have restorations sometimes that don't fit and complicate things in the lab, all in the name of not packing cord, and there's kind of got to be a better way. So this impression I want to show you is really not H&H, so I don't want the H&H people to get angry at me because I know this is not the way that it's supposed to be done. This looks more like H and H and H. There's 3 layers here, so this would be the triple H. I believe that was a wrestler. It's also a band from Vancouver, Hot Heat, that I happen to like a lot. So this could be, I guess, the triple H because there's the original green material that was relieved and then relined with the red material. And then when that wouldn't work out, it was relined, I guess, again, a 3rd time with the purple material. And one of the signs that you can tell that this was done in 2 phases, you can always see that the materials will separate from each other rather easily. And if this was done as a simultaneous impression, these 2 materials will always stick together. They will not be able to be pulled apart like this. So in other words, when you syringe material around the tooth and your assistant's putting material in the tray, and then you seat the tray material onto the syringe material and they set simultaneously, they will not peel apart like this. And that's the technique that I use and we like as a laboratory. But when you go in and you just see this purple material now is here on the prep and here on the prep, and then the rest of the teeth are just covered in the red, there's got to be a difference in the level, in the vertical height between these 2 teeth and the rest of these that are in the red. And that's one of the issues that we have with the H&H technique is that some of the teeth are being represented by one impression material. Now we've got a different level of impression material. Sometimes we'll see the purple. It's not always purple, but we'll see it on the prep teeth and then a couple adjacent teeth, and then it won't continue over. And we get a step, if you will, on the stone model where all of a sudden we have a drop off here. So we've got one set of teeth occluding at one level and then the prep teeth occluding at another level. And that's where we run into occlusal issues. And that doesn't even take into consideration the fact that we have some compression of the material and a tight fit that needs some extra dye spacer. And so when you look at a model that's been poured up, you can see things. As you look at this, you can see extra material over here, and this is represented by where the purple material stops, and we have the green material. So you can very clearly see where those two areas come together. Now, obviously, that's not in an area that's of consequence here, but when you have an area where the material stops and it happens to be on an occlusal surface of a tooth, that's problematic. And you can see other areas where that's happening around here where material stops and another one starts along this area. So this is, 1, 2, 3 teeth in front of the preps. As you look here on that lateral incisor, and if we look back at the impression again, and you can see on that lateral, that's where the green is, and there's no red material in that area. You can see there's red material on both sides of it, but not on that lateral incisor. And so as that happens, as we move around and look, there's discrepancies on the occlusal surfaces of the teeth as well. And so this is one of the reasons why taking these different layered impressions, these bilayered impressions, is difficult. In dental school, when we took these two-step impressions, we would take the initial impression, and we usually did it with a separating medium, like a piece of saran wrap or a piece of plastic that we put over the teeth and took it. But regardless, when we were done, we took a watermelon burr and we hollowed all of it out. We took everything out of there, and then we filled it with material and syringed a little around the tooth, and that all set at the same time. So basically, the putty material was acting as a matrix almost, but we hollowed out all the evidence of the teeth from the inside with a watermelon burr, and then picked up all the tooth structure with that impression that we took at the end. And the H&H technique, all you do, you don't hollow anything out. You take an impression, essentially, and then you put more wash material where the prep is and have the patient bite back together again. And so you've got one preparation being represented by this material while the rest has been impressed by the other, and they're setting at different times. And that's really where we kind of run into those issues. And that's why I understand why dentists want to do things without a retraction cord, and that's why we continue to look at other alternatives. Certainly a diode laser is a great way to get around from having to use a retraction cord in the posterior. We're currently evaluating an instrument from Dentsply, the Aquacel cordless, and I'm getting some good impressions with that, not having to use an impression cord. Essentially, when you look at that, that's basically an impression syringe tip that's about the size of a perioprobe, like this. It's plastic, but it's about the size of a perioprobe, but it's got an opening on the end where the impression material comes out. Now, as you might imagine, if you tried to squeeze with a gun and squirt impression wash material out the end of this, it'd be almost impossible to do, and that's why it actually hooks up to your handpiece coupler, and you step on the rheostat and it's air activated. So the air activates the motor, which pushes the impression material out of this. And so what you're able to do with the Aquacel cordless is take this like it were a perioprobe and actually put it into the sulcus and step on the rheostat and start it, and then move it around in the sulcus like it was a perioprobe, and you're squirting impression material into the sulcus without putting a cord in there. And then you move to the next tooth, if you're doing two, and put it into the sulcus and move it around the tooth like that while your assistant fills the tray, put the tray in place. So a novel idea and an interesting way to be able to do it in a cordless. And you'll see, we'll release a video on that, and certainly you'll see it on Chairside Live as well. Diode laser, very easy to go in and trough the tissue around a posterior tooth. I don't like doing it on anterior teeth because anytime I use a diode laser, and it just has to do with the width of the tip, but I always lose a little vertical height on the tissue, and I don't want to expose a margin like this on an anterior tooth. Back here on a molar, not a big deal. On a central incisor, to expose a margin like this, that is going to be a big deal. Aesthetically, we don't want the patient to be able to see where the tooth and the crown come together. So doing things like diode lasers and this Aquacel cordless, there are ways to get away from packing cord all the time. I do still pack cord in the anterior and honestly a lot of times in the posterior too, because it's part of my prep technique and my assistance in RDA EF, extended functions, and here in California she can pack cord. In fact, she can do a whole heck of a lot more than that. She can take the whole impression on her own, even cement the crown on her own as well. So I understand wanting to get away from the laborious, time-consuming cord packing, but not at the expense of throwing off the fit, of having crowns that fit too tight and throwing off the occlusion of those restorations at the same time. There's got to be a better way to get around that issue than that.
Thank you for that, Dr. D.
You're welcome.
Now let's go to a segment we call Viewer Mail. For this week's viewer mail, we actually have 2 letters from 2 different viewers, and so we'll start with the first one. This one comes from Dr. Bob G. from Connecticut, and he writes, Mike, do all Emax units come pre-etched, or do I need to request it?
Bob, you do not need to request it from us. All of them do, in fact, come pre-etched with hydrofluoric acid. And you can usually tell that just by, if you have to, if you've tried it in, you can wet it and then dry it on the inside, and you'll see that frosty look on the inside. In fact, sometimes with some of our sample crowns, I had a case that I was taking to a hands-on workshop I was doing, and I had mixed up some of the Bruxer crowns and the Emax crowns that we had together, and these were some highly characterized Bruxer crowns, and I looked at the tops of them, and it was kind of tough to tell the difference between the two. And when I turned them over and looked at the inside, it was really easy to tell which ones the Emax were, because they had that frosty look on the inside, because there is a glassy matrix in the Emax material that can be etched with hydrofluoric acid, and it gives that same kind of look that we used to see with Empress and other ceramics like feldspathic porcelains and things like that. So no need to ask for it, at least when you get it from here. I would assume that just about every lab is going to etch it with hydrofluoric acid, because they know that most dentists don't necessarily have it in their office or don't want to use it or keep it in their offices. So I think it's safe to assume that they're going to have it in their offices. If you put hydrofluoric acid on zirconia, it does absolutely nothing to it, and so there's really no way to get that same frosty look on the inside of a Bruxer crown, for example. So everything you get from us will be etched, and I would assume it would be from all major laboratories.
All right, and then our second question actually comes from inside the lab. It comes from one of our technical advisors in the high-tech department who was speaking with a doctor who had a question, and he wrote in and said, "Hello, Dr. DiTolla. This is Harold, high-tech TA. I had an office contact me recently regarding articulating paper. They advised that sometimes the paper is not always leaving a mark on the crown when they are making occlusal adjustments. They are using AccuFilm. Any tips on what the doctor can do or use to mark the occlusal surface better? Thank you."
Well, AccuFilm is a great product, and that's great. So somebody from inside the laboratory, one of our technical advisors, one of our TAs, is writing it for a doctor who asked a question. He thought, that's interesting. I'll turn that into Chairside Live. That's great. And that's one of the reasons why we have technical advisors here at the laboratory. In fact, a lot of them are dental assistants, and so when dentists write in with questions or call the technical advisors, they're able to talk to a dental assistant who's been there sometimes 10, 12, 15 years chairside and can understand the questions, whether it's about retraction materials or impressions or cementing crowns or something like that, or in this case, articulating paper. So when you look at different articulating papers, AccuFilm, for instance, has a thickness of about 20 microns, and so it's pretty thin. And so sometimes pinpoint contacts don't necessarily show up with something like AccuFilm 2. My favorite that I use is actually called Troll Foil, and I like Troll Foil a lot, but that's actually even thinner. That's only 8 microns thin, and so you get some nice distinct marks, but there are definitely times where it won't mark, and when it doesn't, I step back what I consider to be a generation, and I go back to the Madame Butterfly Silk from Almore, A-L-M-O-R-E, and that's 90 microns thick. And so the Madame Butterfly Silk, that will mark almost anywhere in almost any conditions, even if the teeth are a little bit wet. And I'll go step back to that if I'm having a little difficulty with some of the more modern, more precise kind of ones. The Madame Butterfly will mark the lips. It'll mark, kind of everything on the way in. And you'll get some spots marking. You'll get a lot of different spots besides just kind of the point of initial contact. But when you're having a difficult time with some of those thinner, more precise articulating media, I go back to that Madame Butterfly and I find that I can pick up things that I wasn't able to get. And then once I start to dial things in, or once I start to roughen up the surface a little bit before I polish it, I can usually go back to the Troll Foil or the AccuFilm 2 if I want 2 different colors, and I'll find that those work again. It used to be most difficult on something like cast gold, just because marking metal was difficult. And even with these new materials like zirconia and Emax, they're both so smooth that it can be difficult as well. So my advice is to take a step back and go to the Madame Butterfly Silk. I know some doctors like to use the green occlusal indicator wax from Curve. I've always had a hard time using that and kind of interpreting that. So I go back to the silk whenever I need to find something that I can't find with my more precise tape. So Harold, thank you from inside the building on behalf of the anonymous doctor. Unfortunately, as an employee, you cannot win the prize that we would have sent to that doctor, and you will be docked and paid for taking the time to actually write that into us.
No.
That's unfortunate. But Bob G gets a prize for writing in from Connecticut. What does he get?
Bob G from CT gets, how about this lovely photograph?
That is lovely.
The last of which will be sent out for quite some time.
That's right. After this, it's going to be a poster size cutout of me.
Enjoy that.
Because you won't be there, and so that will be something that they will get. Yeah. And what else does he get?
Well, I think that it's time for a joke that we use pretty much every time we have this prize. How about a Chairside live clock?
Right, the black clock.
Yeah.
Who doesn't love that?
Who doesn't love that? That takes us back to a much...
simpler time? Simpler
time where I wasn't growing a child.
You weren't. Were you pregnant here?
Yes, this was just a couple weeks ago.
Oh. Look at that.
Yeah.
You can't even tell.
Oh, well, thanks. It's because I'm sitting behind a desk.
That'll do it. All right, cool. So we'll get those out to Bob. And do we have any news stories today?
Yes, we do.
All right.
Dallas officials are considering ending fluoridation of the community's water system after 50 years. The reason? To save money. The city's contract to fluoridate the water will expire on January 1st, 2015, and is worth $1.8 million. Dallas would be the largest city in the U.S. to stop fluoridation. Some people want to end the process to save the city money. Others point out the inconvenience of residents having to buy fluoride supplements on their own. According to 2012 data from the U.S. Centers for Disease Control and Prevention, more than 210 million Americans drink from a fluoridated water supply, including approximately 20 million Texans.
I wonder. I feel like in the suburbs, everybody that I know drinks bottled water. There seems to be this distrust of municipal water supplies. Sure. But I'm guessing that in more urban areas, they are drinking from the tap. I drink from the tap. I don't mind. We were in restaurants. Of course, it was in Canada this past weekend. And I saw them filling up water bottles out of the tap and then serving it to customers. I'm guessing their water's cleaner. It seemed like it anyway. But the fluoride supply that's in the water is probably going to the people not drinking bottled water in the urban areas, in the inner city. Sure. And so those kids are getting some exposure to fluoride. But out in the suburban areas where everybody's drinking bottled water and missing out on the fluoride, those are probably the kids who are going to the dentist and getting fluoride treatments and maybe having multivitamins with fluoride supplements. So I feel like pulling the fluoride out of the water is really doing damage to the kids who need it the most and maybe don't get the opportunity to go to the dentist and get the fluoride exposure that the suburban kids do. So I kind of hate that. And they say, well, now they're going to have to start buying fluoride, multivitamins and supplementing on their own. But I feel like that's not happening in the inner city. But
yeah, the chances of that happening, I think, are pretty slim. And so I agree with you. I do think it's a disservice to the people who need it the most to take out the fluoridation. So I really hope that they don't actually follow through with it.
Phoenix did this. I don't think there's been a natural water source found yet that doesn't have fluoride in it. Fluoride's the 13th most common element on the planet. Anytime water runs down a hillside, it picks up some fluorine as it comes down. Really all this is, it's not adding fluoride to something that didn't have fluoride in it. It's adjusting the level up to 1 part per million. I just always find it crazy that so many people are suspicious that dentists want to do this. It's actually stopping decay, which are future crowns for us, which we love doing, but by stamping out or hoping to stamp out childhood decay. And why people are so suspicious of dentists wanting to fluoridate the water. I mean, what the hell do we get out of this?
Right.
There's nothing. We don't get any kind of kickback.
No
we don't get commission. If anything, it's stopping us from future work, decades later. And I don't know. So if this is what the people want, all right, give it to them. I guess, dentistry has done what they can.
Yes.
Anything else?
Yes. It's no secret that mixed martial arts, also known as MMA fighting, is dangerous and injuries are commonplace. But when fighter Matt Baker went toe-to-toe, or maybe it was tooth-to-tooth, with his opponent at a King of the Cage event, he got quite the injury. Baker kneed the opponent in the mouth, who was wearing a cheap boil and bite mouthguard. Upon impact, his tooth broke off into Baker's knee. They just didn't know it. Baker was in excruciating pain later that night with a swollen leg and went to the hospital. The doctors found the tooth and he had to stay in the hospital for 2 weeks fighting the infection. He also had to take antibiotics for 12 weeks. Now, Baker is a big advocate for quality, custom-made mouth guards.
Well, he should be the new spokesman for Glidewell's PlaySafe product.
See? And he's been talking to other MMA fighters, telling them, don't go spend $10 on just a boil and bite. Please go to your dentist and get the good kind.
Yeah, and wear knee pads maybe.
Maybe, possibly.
Well, and that's the interesting part of the story is I get that he collides with the guy wearing the boil and bite and the tooth ends up in his knee and he doesn't necessarily know it because of all the damage and swelling. But how does did the other guy not know he was missing a tooth?
I mean, I think maybe he
Or
did.
he just thought it fell out in the ring or something?
He probably fell out.
And that sounds like a pretty bad infection.
Yeah, that is really absolutely disgusting in my opinion. But it's unfortunate. But yeah, he had to stay there for 2 weeks.
And it makes my case of how filthy the human mouth is.
Okay.
Compared to like a dog's mouth.
Ooh, I don't know about that.
Really?
I don't know.
When was the last time you heard about a dog bite victim spending 2 weeks in the hospital?
I don't know. Did they really?
I'm just trying to make you feel better about kissing Parker with an open mouth.
That is so gross. But yeah, and he was actually on, like I mentioned in the story, he was on antibiotics for 12 weeks.
Right.
Which is a long course.
Oh, yeah.
But obviously he's recovered and he's fine. But it obviously was a bad infection, but it could have gone a lot worse. Thankfully, he had the pain and swelling, which prompted him to go to the hospital and seek treatment. But
I'd love to see which bacteria were actually on that. How many different strains were on that tooth, on that central incisor, buried into his leg to kind of cause that reaction. Because there's a lot of real common ones, in the mouth.
Right.
Obviously, when you get buried into a muscle, it's going to be a lot different. But that's pretty amazing. That's a pretty violent for that to happen. And with one of our multi-layered PlaySafe, that kind of thing doesn't happen. Oddly enough, you look at the statistics nationwide, there's more teeth broken in basketball than almost any other sport. And part of the reason is, hockey and certain other sports, you're required to wear a mouth guard, where you're not in basketball. There's a lot of elbow contact and other things where teeth are getting fractured or completely avulsed. MMA, they're required to wear them. But yeah, a cheap boil and bite one's probably not going to get it done. And it's not only tooth breakage that they're worried about, it's concussions. It's the time where you're actually against it and you get hit. When the two TMJ joints just get jammed back into it and all those nerves get compressed, that's where people lights out and lose consciousness. And I think if the MMA fighters knew that there might be a chance that they wouldn't lose consciousness with a better mouth guard, that might be a pretty good promotion for that. Under Armour tried for a long time with this kind of silly little thing that wasn't quite that kind of bite guard. Supposed to help you lift more weight and work out better, breathe better. But it'd be neat to see a promotion like that. I think we did at one point have an MMA fighter who we were working with, but it'd be nice to see a promotion like that for our mouth guards. It'd be something that would really do well, help a lot of people, and maybe get the message out to more kids out there playing sports where they might lose teeth.
It's time to contact Baker's agent.
That's right. We'll get in touch with him and see what we can do. All right, perfect. Thank you. That about wraps it up for everybody here at Chairside Live. On behalf of myself, Megan, the whole crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
I'll see you in a while.
Oh, his rent was too damn high?
Damn.
Still dancing. Marsha. 1001.
Little twist there. Thought he was going to do the boil and bite. And in doubt.
Okay, hold on. One else thing. I still speak English. Don't worry.
All right, so we won't see you again until we actually film Childbirth Live.